Dr. Devendra Sehra Show. This is the name of my show, and I am grateful to you that you have joined it. It is really gratifying when a listener responds to your video. I got a WhatsApp message today from a lady who said that I'm not very well conversant in Hindi and you make a video in English regarding GDM. And she has sent me some questions which I have noted in my own language and I'll be answering them one by one and I'll be very specific. First is, what is GDM? GDM stands for Gestational Diabetes mellitus. It means that any diabetes which is detected for the first time in pregnancy is GDM. Is pregnancy in diabetes different? Yes. If a lady is already a diabetic and she becomes pregnant, then it is a totally different category and it is known as diabetes and pregnancy, and it is not GDM. What is the difference between the two? Both are totally different. Both have been classified separately because a lady who is already a diabetic, when she becomes pregnant, she is exposed and her fetus is exposed for the first trimester also for diabetes and maybe it's uncontrolled, and most of the development of the baby in utero occurs in first 3 months. So chances of congenital abnormalities are much more in a lady who is a diabetic and who becomes pregnant, and they are almost nil or the same as otherwise in ladies who become diabetic during pregnancy. Why does GDM occur and when? I answered partially in the last question. GDM tends to occur in the second trimester, and it occurs because the pregnancy hormones, the hormones released during pregnancy, are causing insulin being released in the body to be a bit resistant. And if the pregnant lady has already a compromised reserve of insulin in her body, then she may become a diabetic during pregnancy. How is GDM diagnosed? GDM is diagnosed very simply by giving 75 gram glucose in about a glass of water over 10 minutes to a lady who comes to the clinic, irrespective whether she has eaten earlier or not. And after 2 hours, we measure her blood sugar. If it is more than 140, she is a case of GDM. Since it is important, I'll repeat. A lady who comes to the clinic and whether she has eaten anything or not is given 75 grams of glucose, and after 2 hours we check her blood sugar. If it is more than 140, that is GDM. What are the predisposing factors leading to GDM? Family history, obesity, sedentary lifestyle, chances of having become diabetic in the previous pregnancy. These are all predisposing factors which are leading to GDM. Why should a GDM pregnant mother take the treatment? This is very important because the expectant mother should take the treatment because the fetus in utero is also making insulin. His or her pancreas is making insulin since the baby was 1.5 months in utero, and this insulin which is being made by the baby inside the uterus should be for not more than 140 milligram percent. If the expected mother's blood sugar is high, that insulin being produced by the baby in utero is higher. And since insulin is an anabolic hormone, it will lead to weight gain in the baby also, and a condition called macrosomia occurs, which leads to more chances of cesarean. Along with that, immature lungs and other immaturities like lessening of water around the baby or increase in volume of the water around the baby may occur. How is GDM treated? Treatment of GDM is in three forms. One is giving this medicine if lifestyle measurements or exercise or diet does not succeed. First of all, we try to go more with the physical exercise. If the lady has low lying placenta and she has been advised bed rest, then she can do physical training exercises, upper arm exercises, sitting on bed. Otherwise, she can go for a walk half an hour a day, and then giving her diet, which is three small meals interspersed between three major meals, or two small meals interspersed with three major meals. That is 5 meals will help her. And in spite of this, if blood sugar is not under control, then she is given insulin. Can tablets of sugar be given? No, because tablets tend to cross the placental barrier and may make the baby hypoglycemic, that is low in sugar. So only placenta non-crossing drugs like insulin is given so that it does not cross placenta and baby is not exposed to side effects of insulin. Only metformin has been advocated in those ladies who have become pregnant on metformin. Otherwise, no other oral hypoglycemic agent is allowed. Is insulin dangerous in these patients? No, insulin is not at all dangerous in these patients. There have been studies where mothers have got hypoglycemia and they have even become unconscious by hypoglycemia. But no danger to baby had been seen in utero in those patients. So insulin, if indicated, should be taken by these women. What is the level of accepted sugar in these women of GDM? Yeah, this is important question, but leave it to your doctor. We accept fasting blood sugar of about 95 milligram percent and 120 milligram of sugar after 2 hours of meal, and after 1 hour it should be 140. I'll repeat: 95 fasting, 140 after 1 hour, and 120 after 2 hours. What is the advice you give to parents? Parents are advised that after the baby is born, both the nursing mother, she should be taking a nutritious diet, should be going to walk, because such type of ladies become diabetic. They have more tendency to become diabetic, though diabetes gets back and there's a reversal of diabetes after delivery. But about 5% of women become diabetic every year. And these newborns also, after the age of 5 or 6 years, tend to put on weight. So both good nutritious diet and exercise is advised both to the nursing mother and later on and to the baby which has been born. So I think these satisfy your query. Thank you so much.